thank you for this opportunity to share with you all a bit about my research, looking to build sustainable systems of care for persons who use drug and alcohol. It's always important to start with what we know, and we know several things. First and foremost, there is a high burden of care among individuals using drugs and alcohol, and what I mean by that is substance misuse is often highly comorbid with other medical, mental, and social health conditions such as heart disease, diabetes, cancer, mental health, and the criminal legal system. All of these factors are combined together to create incredibly complex systems of care that are difficult to navigate. Second, we also know that social support is critical. Social support can help or hinder access to care. Some research that I published last year found that among a sample of men leaving prison with substance use disorders, their social support partners and themselves their perceived care needs matched each other, indicating that health literacy can be shared to increase access to services. And finally, just because someone meets a diagnosis or qualification of a substance use disorder or screens for substance misuse does not mean that they will want treatment, access it, or engage with it. So this is where my research agenda is framed at this intersection of substance misuse and the criminal legal system to try to understand how we can build and create equitable and sustainable systems of care to promote service use among persons using drugs and alcohol that meet their respective needs with an attention on historically marginalized and oppressed populations. So a few projects I'm currently involved with to kind of start to chip away at this really broad research question. First and foremost, I'm leading a qualitative interview with the Community Outreach and Intervention Project, asking qualitative questions among persons using drugs, seeking care at a mobile health van that my colleague Dr. Jarrett talked about. And with these questions, I'm asking and looking to understand past help-seeking behavior, as well as how do they understand their care needs and what has largely been missing in their care. Secondly, I'm helping with an evaluation led by internal medicine faculty, Drs. Poorman and Dr. Mesmer. They've created a community-based community-based addiction medicine rotation designed to increase specialty care knowledge for drug and alcohol use, as well as to try to create and decrease mechanisms for decreased stigma in provision of care for addiction medicine, which we know is highly pervasive. All of these with the hope to build systems of care, not cure. So hoping that long-term we can create and design cross-collaboration, interdisciplinary education and training across a spectrum of healthcare providers, physicians, psychiatrists, social workers, pharmacy, with a focus on harm reduction measures so that we can start to mitigate risk associated with drug and alcohol use. Ideally, also trying to use some of this research to advocate for better and equitable policy and funding. So trying to create addiction care models that are reimbursed at a similar rate to other chronic care diseases to try to hopefully start to make integrated care as a standard of care. And finally, with this research, having it be community-based, centering it among the agencies that are doing the most with the least resources and understanding what that provision of care looks like, and centering always consumer voice and letting their experiences drive the research approaches and innovation that we need to create equitable systems of care. Thank you.